This explainer is based on the patient information sheet, Understanding Visually Induced Dizziness, a plain English information sheet for patients, published by Australian Dizziness Clinics, available at australiandizzinessclinics.com. Now, if you, or maybe someone you care for, has been struggling with a really frustrating, hard-to-describe type of dizziness, I want you to take a deep breath. You're in exactly the right place.
Right off the bat, I want to tell you something incredibly important. Your dizziness is real. It's not all in your head, you're definitely not making it up, and this is huge. It is absolutely not a sign of some hidden, dangerous disease or brain damage. It's so common to feel terrified that something is permanently broken inside you, but as we're going to see, what you're experiencing is a recognized, well-understood condition, and the best news, it is entirely treatable.
So here's our roadmap for today. 1. What is visual dizziness? 2. The brain's stuck habit. 3. Identifying your everyday triggers. 4. Retraining with gentle practice. And 5. Recovery and next steps. Section 1. What is visual dizziness? Okay, let's dive into this. A lot of patients with visually induced dizziness, or VID, have had MRI scans, blood tests, their inner ears checked, the whole shebang. And everything comes back totally normal. So, what's going on? Well, think of it like a computer. Your hardware is completely fine. What you actually have is a software glitch. VID is basically a stuck balance habit. It's a condition where visually busy environments make you feel unsteady, floaty, or like you're rocking on a boat. Notice I didn't say spinning. It's more of a wobble. And very often, this whole thing kicks off after a completely separate dizzy illness that your body just kind of forgot how to reset from.
Section 2. The brain's stuck habit.
To really get why busy places make you feel so awful, we need to look at how your brain actually keeps you upright. Now, in a normal balance system, your brain relies mostly on your feet and your inner ears to know where you are in physical space. Your vision, it's really just a tiny piece of the puzzle. But when you get a dizzy illness, your inner ears start sending garbage data. So your brain, being pretty smart, starts leaning heavily on your eyes to keep you from falling over. The problem with VID is that long after that initial illness heals, your brain stays stuck in that emergency mode. It just keeps leaning way, way too heavily on your eyes. And that intense reliance on your eyes, it creates a massive sensory conflict. Picture this. You're standing perfectly still in a supermarket aisle. People are walking past you, brightly colored shelves are stretching down the aisle. Your feet and your ears are telling your brain, hey, we're standing perfectly still. But because your brain is so hyper-focused on your eyes, and your eyes are seeing all this crazy movement and pattern, they're screaming, no way, we are moving. That mismatch totally short-circuits your brain's balance center. It gets overloaded, and the direct result is that rocky, unsteady, floaty feeling you know all too well. Section 3. Identifying your everyday triggers. Identifying exactly what environments cause your symptoms is absolutely crucial. When clinicians measure this stuff, do you know what consistently scores right at the very top? Walking through a supermarket aisle or shopping mall. These are massive, echoing environments with harsh lighting, crazy complex patterns on the shelves, and a constant stream of moving crowds in your peripheral vision. It's literal optic flow overload. So if you absolutely dread the grocery store, please know you are not alone. It is universally the toughest challenge out there for a visual dizziness brain. But it's not just the supermarket. Other super common triggers include riding as a passenger in a car. Think about it. You're sitting perfectly still, but the whole world is whizzing by your window. Escalators and heavily patterned floors really confuse the visual system too. And in our modern world, just scrolling rapidly through social media on your phone or watching an action-packed movie can be more than enough to provoke severe symptoms. Honestly, even just sitting in a room with harsh fluorescent lighting can flicker just enough to really bother a highly sensitized visual system. Section 4. Retraining with gentle practice. So, knowing your triggers is the first step, but how do we actually fix this software glitch? First, we really need to talk about what doesn't work. Look, it's totally human nature to just avoid the things that make us feel terrible. But avoiding the supermarket or refusing to drive completely starves your brain of the practice it actually needs to relearn how to balance. Likewise, taking anti-dizziness tablets might temporarily mask the symptoms, but they actually sedate the brain. They actively prevent it from fixing that glitch. What actually helps is gentle, gradual practice in those tricky environments. This is also often paired with talking therapies, like cognitive behavioral therapy. Because let's be real, dizziness causes severe anxiety, and anxiety just ramps up your nervous system. So managing the worry, that's half the battle right there.
To teach your brain to trust your feet and ears again, a vestibular physiotherapist will help you build what's called a graded exposure ladder. And this is key. You do not just force yourself into a crowded mall on day one. Absolutely not. You start at the very bottom in a safe, controlled environment, and you don't step up to the next rung until your brain has completely adapted to the one you're on.
So, what does breaking this habit actually look like in real life? Well, step 1 is low complexity. You might literally just practice moving your head side to side while sitting perfectly still in a quiet room. That's it. Once your brain handles that, you step up to moderate complexity. That might mean taking a short walk down a quiet street with just a little bit of traffic, or watching a few minutes of television. Only when you have totally mastered that do you tackle high complexity, like navigating that busy shopping center. Pacing is absolutely everything here. The goal is to go into the situation, feel that mild dizziness, stay calm, and just wait long enough for the symptom to settle before leaving. You are carefully, methodically building your brain's tolerance back up.
Section 5. Recovery and next steps.
I want to be super realistic with you here. Breaking a deeply ingrained neurological habit, it does not happen overnight. To keep well during recovery, you need to expect that this will take weeks, maybe even months of consistent practice. You are going to have good days, and you are definitely going to have bad days. The absolute most important thing is to keep practicing. Do not fall back into the trap of avoiding your triggers. Keep addressing any anxiety that bubbles up, because remember, worry physically amplifies those dizzy signals in your brain. And finally, if you get a bad cold or hit a really stressful patch at work and you feel your symptoms flaring back up, don't panic. Just drop back down the ladder a bit. Return to your basic, easy exercises early to gently remind your brain of the right way to balance.
I really want to leave you with this incredibly empowering thought directly from the clinical materials. Understanding it is powerful. This is a stuck, balanced habit your brain can relearn, not damage. So the crucial points to take away today is this. Your brain got you into this habit to protect you when you were originally sick. And because your brain is brilliant and highly adaptable, it has the complete capacity to learn its way right back out of it. You are safe. You are just recalibrating. As we wrap up this explainer, I have a quick question for you to carry into your day. What is one small, gentle step you can take today to safely practice in a challenging environment? Maybe it's just looking at a patterned rug for 30 seconds while doing some deep breathing, or maybe it's watching 2 minutes of TV without looking away. Whatever it is, take that brave first step toward retraining your brain. You have the tools, you have the understanding, and recovery is entirely possible. For the patient leaflet and the rest of our patient series, visit AustralianDizzinessClinics.com. Please bring any questions you have to your next medical appointment. Thanks so much for joining me, and take care.